We are not handmaidens, nor Vestal virgins, who are programmed to carry out the task of others. I wish to bring to you tonight some thoughts on this nursing spirit, what it means, where it might go, how we can be assured of going with it, and the kind of heritage we are creating for future nursing. Steele, and I'm a nurse clinician. I'm a registered nurse, and I've learned to do some extra kinds of things for patients in taking care of them. One of them is examining you and taking care of your health problems. Now, some of the things that I'm going to do with you will be familiar to you, like taking blood pressure. Some of the extra things or special things that you've not had happen before, perhaps, are things that I'm going to be interested in your life and how things are going. I would like to be able to teach you what to do for yourself when you become ill, when to call me and when not to call me, and when you can handle it yourself. In order to do this, I'd like to see you yearly and more often if you need to. As a nurse practitioner, that's my title, for whatever that means. The arrangement up here is that I work with a physician who happens to be in the next room to me. Sometimes you meet him and sometimes patients don't. But he's available to me for consultation. If we run in, you and I run into some problem that we seem to need a physician for, easy to call him, okay? And I don't want you to feel uncomfortable about seeing a nurse, that's bad or that's different or that's not good enough. I've had some experience, and I think as we visit this morning, you'll find that probably we can pretty well meet your needs. And when we need medical consult, we'll get it. Okay? Good. What I thought I'd do today was an abdominal exam and a pelvic, and then look for her records, because if she was seen a month ago, I don't want to repeat a bunch of stuff. But on the abdominal exam, I do feel the size of about a 50-cent piece lump in her lower left adnexa by palpation and tenderness for her. I don't feel much of anything internally on a pelvic, although she has tenderness in the same general area. And before I let her go, would you check that lump and see if you too feel it? Sometimes people have the image of nurses giving shots and making beds, and they're surprised when they see me giving this kind of complete care. And they want to know if what I'm doing is really nursing, or if I'm a nurse who's trying to be a doctor. No? Just hurt. Okay. Does it scare you?
Yeah.
Yeah, I bet it does. What are you thinking about?
Cancer.
Are you? Yeah. There are other things that can happen to breasts, too. It doesn't have to be cancer. But you know something? You did the right thing coming to ask for help. It's people that stay home and don't tell us they got a lump, you know?
Right here.
Okay. Why don't we have a look at it? Come on and sit up here, okay? And did you feel this lump last week?
I've been feeling it a long time.
Yeah, you have, for a long time. You know something, you're awful skinny. I'm wondering if you're feeling your own rib in there.
It could be.
Yeah, because I don't feel a lump there, Lenny.
Well, there's one more. Well, nobody hurt.
Put your finger on where you're feeling it. Right down there. Okay, now let me feel there. If you run that this way, you'll find it's your rib, and it comes right to the middle here.
If you had much lick as I had, you'd be scared too.
I'm sure of that, Lenny. Yeah, okay. That's not an insult. But the point is, for you and I that are skinny, we feel it. When we put our hands on our ribs, we can feel it, you see. And that's what you're feeling.
But I can't understand that. Why?
Why?
My rib, sometimes you lay down, you get every damn time I turn over. My mama, it hits me sometimes.
Yeah.
Sometimes.
Sometimes he hits you? Is that what you said?
Every man is the woman sometimes.
Yeah, right. Has he been hitting you on that side?
No, you didn't hit me here. I was kicked here.
You were kicked there. And when were you kicked there?
Last week.
Last week. Is that when the...
Broken up a fight.
Okay, that's good. I'm glad you're telling me that. And is that when the pain started to... You started to feel it? Yeah. Did you win?
Yeah, we.
Yeah? Okay, good.
I won't tell you, but I cut the grass.
You did. What I did in this case is nursing, which I am trained for and licensed to practice. The examination and diagnosis I made could have been done the same, probably by either nurse or doctor. I then went further in exploring the patient's feelings, as it's a common misbelief that being hit or kicked in the breast would give one cancer. You're going to be all right.
Okay.
Okay. Here, why don't you get your coat?
Yes, ma'am.
It has traditionally been the concern of nursing to go beyond the medical diagnosis and ask how the patient's health is related to every aspect of his daily life. When can the patient go outside, mop the floor, have sex, go back to work? These are the questions of concern to the patients themselves, and nursing's ability to answer them forms the basis of a valid, autonomous profession. What's the meat you've got in the refrigerator?
Me?
Yeah. You got a small piece. Let me show it to you.
Oh, that's a piece of meat. I'm going to throw them all away.
Yeah, I think maybe you better throw that piece out, okay? That doesn't look so hot. That might make me sick. We've got one little piece of beef in here, Miss McGrath. Maybe you could fix that up for yourself.
Well, I got some beef up today and took it.
Yeah. Well, sure, you haven't got much here. You got to get Murray to buy you some food. What's on your mind, do you suppose? What are you thinking about?
Oh, just because I'm not well.
Yeah, just feeling poorly all the time makes you feel sad. Are you having trouble preparing meals? Is that a problem for you?
Well, I don't know. I suppose if somebody else give it to me, I'd eat it.
You'd probably eat it.
Yeah.
These are both heart pills.
Are they?
You've been taking one of each?
Oh, Lord.
Huh?
I thought that was for the fluid.
Which, you've been taking one of each?
I took a half the heart.
Yeah.
And one of the other one.
And one of those?
Yeah.
Yeah, they're both heart pills.
Are they?
Yeah.
All right.
That's why it went up so high. That helps to explain it to me. You know, the last time you were in, it was higher than it should have been. So you were taking twice as much.
Well, where'd the pill for the fluid?
So this surely is making you feel awful.
Is it?
Yeah.
Okay.
Yeah, because that's part of why it's too much, and that's part of why making a home visit every once in a while is not a bad idea with you. Huh?
Yeah, well, I thought that was fluid pill.
Yeah. The feelings that you've had of feeling kind of worn out and not caring much about eating and stuff has to do with having too much heart medicine. Yeah.
And then I thought I didn't have enough.
Well, you had enough.
Yeah.
You had a little bit too much.
Yeah.
Okay, so you won't take that, even though I've written on the bottle heart. Do not take that tomorrow morning.
Yeah. When you tell me how much I have to take.
Yes, and I will be very specific as to what you're to take. I might even come back here to be sure you're taking the right thing. Okay?
Yeah.
Okay, well, I'll buzz. Now listen, you let him get you some food and you start eating it. None of this, I don't want any stuff.
I elected to take care of the mother and the children as family physician.
Good.
The problem is that going to court and being the petitioner and being an advocate for the children has put me in a conflict. I'm not sure I can provide the best kind of care for her, given the circumstances of my advocate for the child.
I can understand
And I have to go to court. I would like, she's to see me today, I would like to suggest to her the possibility of seeing you after I examine her and talk with her and tell her that I'm concerned about my difficulties in seeing her and providing care for her.
Sure.
If she agrees to that, I thought you'd be appropriate.
I'd be glad to meet her and would be glad to take her on.
Okay, well, why don't I introduce you to her right now?
Good.
If you have the time.
Yes, I'd like to do that.
Very good. Thanks,
Thanks a
Doc.
lot, Ben. Yeah, that's great. I'm going to Cambridge now. It's Wednesday. I spend one day, one afternoon a week in Cambridge in office visits. In my private practice, I have a joint practice and partnership there with Robert Funkhauser, who is a physician internist and a specialist in gerontology, or care of the aging. We have been together several years now, and both of us take care of our own panel of patients, but many of the patients that we care for, both of us know, and both of us participate at different times in what we do for them. Joint practice is tremendously exciting because it permits the nurse and the doctor to work together as equals, to share their knowledges, and to give the patient more complete health care than either one could do alone, and to focus more on keeping people well instead of only taking care of them when they're sick. I'm fortunate to have a doctor partner like Rob who has really understood what nursing can do and encouraged me to practice my nursing like I never have before.
The role of nurses is definitely, it seems to me, going to change during the next few years and couple of decades toward more independent responsibility for data collection and synthesis of clinical information, roles that have been traditionally thought of as doctors' roles, but which nurses have been doing for decades already in a covered kind of way. I think that this is going to be made more explicit and is going to be regulated in such a way that it will be done more responsibly, and the education for it will be better directed. I have no doubt that this is going to be the coming trend in nursing education.
In years. Spring
My
yourself.
annual visit.
You're a present. Isn't that sweet of you? Thank you. Appreciate it. That's very nice. Why do we have a urine cup or something? Yeah, right. I'm sure we have a base. Rob and I share the rent and office expenses of our practice. When we began our partnership, we agreed that our rates for care should not be different because patients expected the same service, whether it was given by a nurse or a doctor. Since most people aren't accustomed to seeing a nurse in private practice, it was a question at first where I would get patients. Rob referred me some of his, and so did other doctors that we both knew. Then once I got started, patients began to send their relatives and friends, and in about 4 months, I was very busy. And the greatest compliment and the most humbling was when doctors and nurses started coming to me for their own care.
Yeah.
That's beautiful, isn't it? Wouldn't you like to be sitting right there on that rock right now?
Yes.
Yes, I would too. I would too.
I
That would
would.
be. Mrs. Elliott and I have known each other a long time, and we kind of know.
so.
We kind of know when each of us need to do things.
Tight places.
Yeah.
Yeah.
Well, you've done that yourself
I
too.
know it.
But
I needed moral help.
we've kept you at home.
Yes.
Yeah.
Oh, yes.
Yeah.
Yeah, that's right.
And you've been feeling well.
Yes.
Here and wherever I practice, it is my responsibility to know the limits of what I can do.
That's the big
If a patient comes in with a problem I can't handle, I refer him to others who can. The one area where I am completely dependent on medicine is when a patient needs a drug. Legally, nurses cannot prescribe, so my partner assumes responsibility for this part of my practice.
The nurse is practicing nursing under the Nursing Practice Act, and the doctor is practicing medicine under the Medical Practice Act. And the definitions of those two kinds of practice is sufficiently broad that the things that we do in a joint practice really are licensed.
How do you feel about having a nurse take care of you?
How do you mean a nurse?
Well,
This one?
yeah, that one.
She's not a nurse.
What is she?
She's a clever friend with great knowledge of human nature and lots of other things. Yeah. I think it's wonderful.
I think what she was wondering, Mrs. Elliott, was do you find there's a problem in not always seeing a doctor, but most of the time seeing a nurse? And
well,
how have you worked
I
that
don't
out?
need a doctor all the time, do I? I mean,
I've
no,
agreed with you
tell
about
me.
that, right.
Certainly. And
Certainly.
he's very busy, and I think was a bit bored with my kind of case.
Well, except that he's
Yeah.
very fond of you.
Well, that's good.
Yes.
I'm fond of him. I call him my favorite man.
That's right.
All we old women have favorite men.
Well,
And then you're interested in what goes on in my life in a way that Dr. Funkhauser isn't an ordinary doctor.
Mhm.
Don't you know what I mean?
Yes, I think that's
No.
probably true.
How do you feel sharing your practice with Jean, a nurse?
I feel jealous. It, I have very much valued the one-to-one relationship that I have had with a great many of my old patients, and Jean has taken a lot of those patients over as their primary practitioner. Mrs. Elliott, who we've seen before, has been very much related to me for many years before Jean joined my practice, and is now primarily related to her, and is a good example of why I feel jealous about this interference with my relationships. However, I do feel as though it has been a great blessing to some of my patients, and I really believe that it is a useful and good way to conduct a practice.
Goodbye, dearie.
Dearie, I'm going to give you an appointment. A few patients refuse to see a nurse, and Rob and I would not think of interfering with their right of choice. About an equal number choose to see only me. Many patients we both see, and they are often glad to have two people taking care of them instead of just one. We have no set pattern on who does what for each patient, but together we decide how we can best combine our nursing and medical knowledge to help each patient. I've just been today down to a nursing home to see Mrs. McGrath, who's been there, about a week now. She seems to be doing quite well.
No, this is her son's child.
Oh, I see.
Yeah.
Okay.
Oh, what a beautiful
Really? Yeah.
Everybody in the hospital was crazy. But, huh?
Really?
You never
How
seen
old?
It's just about a month old.
Is that right?
And babies is half.
How nice that they brought him around, that you
Yeah,
could see him. Getting ready to come home?
Yeah, I'm home next week.
Yay, for sure?
Yeah, I'm kind of shaky.
I know, but I'd much rather see you at home.
Yeah,
Wouldn't you?
Yeah.
Getting restless? Yeah. I think you're doing swell. Huh? She's stronger. She's walking around on her own. She had some physical therapy to strengthen some of her muscles. She's eating better. She's gaining a pound or two. And I left word that it might be appropriate to bring her home in about a week with some advance warning to me so I can help to get a homemaker in the house ready for her for supervision of what she's eating and hopefully can hold her at home.
The medical situation with her is a little uncertain because there is an elevated white count that we didn't understand at first 6 months ago, but somewhat discounted. However, it has persisted in being elevated and is not elevated to the point of leukemia. She's had a number of studies to try to be sure that she does not have leukemia, and we have assured ourselves that she does not. However, while she was in the hospital, she had some kind of minor seizure or other difficulty that led her to be transiently unconscious and have a visual disturbance afterwards. So that if she has further spells like that after she gets home, that may complicate her independent living.
That's interesting, because the son who was at the nursing home today told me that 2 days ago when he was there, she didn't know who he was. A son that goes every day to her, and that she was confused and unsure where she was. That's very interesting. In view of that, do you think she should go home, even in a week's time?
I would like to see her try it, but I think that we need to arrange to watch her closely.
Mm-hmm. Good. Okay. That's very helpful. Okay. Well, I think I'll buzz.
Thanks for coming.
You're welcome.
Yeah. Well,
It's good to see you.
Yeah.
I hope it makes you feel better.
I hope so.
Good luck. Some of us feel that the reason we stay here and go through all this is that we have what's called a rescue fantasy. That if we stay, we will be able to rescue this. And we can laugh about that. I hope you can too, that, maybe we can rescue it.
That's a clinic.
Yeah, it could
There's
be
other
good.
people that
It
run
could be
things that are
good.
bigger than this.
Yeah, that's right.
McDonald's probably sees about the same number of people a day.
Well, we don't all turn out the same hamburger. The same.
True. And there's just some basic methodologies.
Do you ever go home?
I have started going home because the bus changed its schedule, and it now has the last bus leaving here at 6:35.
Yeah.
So,
I still think you're great, but I don't want you to kill yourself. Okay. See you later. An important part of my work at the clinic is helping other people on the staff to develop better joint practice collaboration.
Patient's need was to see a doctor.
I don't read that from that. Not necessarily the first visit. Perhaps the
Potassium was 6.6.
That's a high enough level that that patient should be in the hospital. And that patient could have a cardiac arrest. It was an 84-year-old woman with a crit of 26, which has since gone down to 24, and a K of 6.6. She's a very sick woman. And beyond my confidence as a nurse. Yes, he was. And his reaction that particular day was, she's your patient.
Okay, Peggy, I'm aware of that situation, as you know, and I still feel that doing an initial assessment and workup of that patient was clearly within your ability and your skill. One other sub you brought this up too, is that patient isn't appropriate for me. Well, there's no one in God's world that's going to be able to identify that until the patient's sitting in your office and you're doing an assessment. No appointment clerk is going to know that. Nobody at our front desk, no aide, okay, no doctor, no anybody.
Well, then I think that maybe this is something that should be brought up at the Friday meeting with the physicians so that, you know, we're all together talking with them. And maybe we'll get a little bit more cooperation.
I think that is one of the things that we have in mind. But some of them are beginning, because of your anxieties, are beginning to dance around a lot and coming to me and saying, I don't really think, you know, they can do that. I'm saying, yes, they can do that. And I need your support in making that happen. They're not going to trust us until we have demonstrated what we can do, what knowledge base we have, and how we use it. They are not going to like to take a patient from us.
What I think in the end will happen is that many of these complex patients will wind up seeing a nurse twice in order for the nurse to do a full evaluation. They'll have to see the doctor because the doctor really will not be able to get a good feel of the patient without really having talked to the patient for a significant period of time and reviewing the chart.
Excuse me, I have a problem in that I'd say I know more about knowing that the patient needs a doctor more than you know when possibly a patient needs a nurse.
Well, I'm going to say something. I'm going to ask the question. How many workups have you repeated of mine? Jill, have you repeated any of my workups?
You know, how many have we had? I mean, we haven't had that many new patients. You know,
Recently?
Yeah.
Well, I've had
Maybe
quite a few. You haven't received
maybe
them
10 or so. Yeah.
recently, but in the beginning.
Some have been referred back to me as return appointments, and frankly, I didn't have enough time to see them. There were one or two that, you know, when I'm not having time to see them because I really felt they needed a significant chart review and so on.
But you
So it's just a
repeated my
couple.
workups.
Oh, no. And once there's a workup done, I'm not going to bother repeating it. Oh, yeah, they're adequate. Sure.
Well, then,
But I have reviewed the chart in the old part of the chart, and I think
It's been
I have to say, I think chart review is something that probably doctors do a little better than nurses. I think, and being able to ferret out lab results that have been abnormal in the past, parts of the history that have been abnormal. I think taking a history, I think nurses are very good.
Short of comparing who does it better, it might be maybe possible for us to look at how then does a doctor and a nurse relate to one another in the care of a patient. What is a joint practice? Is it having some comfort with your partner and knowing what limitations, what abilities, what skills, what areas are needing help, or completely an arrangement, maybe non-paper, maybe a verbal agreement of up to what point do you trust the other person? And part of the joint practice has to be a trust in the other guy.
I know that I can speak with working with Joanne. I've been very pleased because I think that as Jean says, her workups are detailed, neat, and probably because she's a female, her handwriting is neater than a male. I don't know if that's genetically carried, but maybe it's professionally carried. But whatever it is, I can read them, which is very pleasant. And sometimes it comes out that she has a question that she needs a response to. And the rest of the examination or the rest of the thing is fine, and that's what she needs. And she comes to me with a specific question, and I ask a few questions, and I think I can get a reasonably good feel for what's going on with the patient. Now, there are times she says, listen, I just do not understand what's going on with this patient. And then she presents me with the big chart, which is really a very welcome sign. And that's what I'm supposed to deal with. And I think that's appropriate. And I think what has happened is that the relationship has sorted itself out in an appropriate fashion.
My feeling, really, that nurses are very afraid to be smart people, and many of them are smart, but they're afraid to really practice it. Terrified of change. They've culturated themselves into such a strict role, and they know exactly what to do in a narrow little defined area, and God forbid anybody suggests they do something else.
But wouldn't you think safety in numbers would appeal to them?
But you don't. You just got finished saying that you don't have that group, and so that's why it doesn't work.
This is what we offered.
Well, I have to say to you very facetiously, I'm not sure I'd worry about them.
Well, I've stopped.
Almost. I'm not sure you can make change with everybody that you'd like to, or that you think, maybe you work on the younger ones.
We're ready.
Yeah, sounds from what you're saying. We're scared. Sure you're scared, and some of you may, in fact, lose your jobs because that's happened in a couple hospitals. I believe somewhere in the North Shore, some nurses have lost their jobs because they felt it was time to teach patients post-operative stuff or pre-operative, and out they went. There will be struggles over the attempts of progress and change. But as the public comes to understand that expanded roles for nurses means better care for them, those changes will inevitably occur. Our responsibilities will never be equated down to some list of mechanical tasks. We are members of a living, breathing profession, and our role is defined not on paper, but in practice, by us. Let each nurse determine, based on professional standards, how she can expand her practice in her own setting. As a wise man said, no one has ever done anything great or useful by listening to the voices from without. Thank you. I knew very little about what Mother's life as a nurse had been. She never talked very much about it. I knew some of what Dad did, but I didn't know much about medicine, really. I like to be with people, and it may have been that part of it turned me on. When I first went into my life, I was going to be a businesswoman and went to business school and wasn't very successful at it, and I didn't like it. And thought, well, maybe I'll try nursing. That seems interesting. It was